I'm Dr. Ronen Bordowski and I'm managing the Malo Clinic in Tel Aviv. Today I'm going to speak with you about the all-on-4 technique. So what's all-on-4? All-on-4 is a concept that was invented 18 years ago by a Portuguese dentist, Dr. Paulo Malo. And what for? Usually when a patient loses all of his teeth in the upper or lower jaw, or he has a very sad situation of periodontic disease, or we are facing old rehabilitations, old porcelain crowns, old implants that are failing, we need to solve this problem in a big solution. What do I mean a big solution? The used technique is by inserting between 8 to 12 implants to every jaw and then waiting for something like 6 or 9 months. Afterwards, putting crowns above those implants, that takes another 2 months. And then after something like 1 year, the patient can get his teeth. Dr. Malo thought about this idea and he got to a conclusion that it's too long, it's too expensive, and it takes a lot of suffer from the patient, because inserting those 10 implants, we need usually to do bone augmentation, sinus lift before that, because in 60 to 70% of the cases, the patient don't have enough bone to insert the implants perpendicular. So, Dr. Malo with the Nobel company, the Swedish implants company, thought about another concept. His concept was inserting 4 implants not in a straight position, but in up to 45 degrees to the bone. That helped him to avoid the sinus lift augmentation by inserting the implant in the angled position. Above those 4 implants, Dr. Malo invented the concept of immediate loading. What's immediate loading? Usually when we do an implant, we wait between 4 to 6 months for the bone to adhere to the implant, and then we can load the implant with a porcelain crown. In the all-on-4 technique, immediately after inserting those 4 implants, we are putting the load of all the jaw. We are preparing crowns, between 12 to 14 crowns to a jaw, and then we are putting those crowns above the 4 implants that were implanted in the same day. One can think to himself, how can it be? Because usually when we have to wait for so long and in comparison we do it in the same day, usually the quick solution is not the best solution. But there's a big but. There's a big difference in our logics. Dr. Malo, when he invented the technique, took many cases, thousands of cases of normal rehabilitation with 10 implants, and he measured the forces of the occlusion above those implants. What does it mean? When I insert 10 implants in a jaw, one can think it's like a table with 10 legs. When I put a weight on the table, then the weight goes to those 10 legs equally, something like that. But in the implants in the mouth is something else completely. When we insert 10 implants and we measure the forces of occlusion, then we can see that only 4 implants are taking something like 90% of the occlusal forces. Only the 2 front implants and the 2 back implants. The other 6 implants take only 10% of the forces, which is not as a table with legs, because with a table with 10 legs, each leg take something like equal force. Now, from this concept, Dr. Malo took those 4 implants and tried to make them better, to make them stronger, and to make them to take more than 100% of those forces. So, with the Nobel implant company, they invented a special implant that was specially for this technique. Now, in the same day, what we are doing is we are extracting, we're pulling out all the bad teeth in the jaw or in the mouth, upper and lower. Immediately, we are inserting 4 implants to the best place of bone. What do I mean? When we open the bone, we can choose where is the best bone that the implant can insert it in. Now, in the old technique, we should have put the implant perpendicular. In this technique, we can put it in 45 degrees, which means I can choose the exact location of the implant. After inserting those 4 implants, it's a very quick technique, about 1.5 hours. Then, with the collaboration of our technician that I'll stay in this clinic in the same day, we are producing a full arch of teeth that is screwed inside those implants, so the patient leaves the clinic with teeth. Now, I know it might be a bit scary or odd, but the Nobel company made a lot of studies, and the scientific part behind this is huge, and I won't get into it. But from something like 250 studies that were made in the last 12 years, the conclusion is that we are reaching 98.1% of success, which is the most successful technique in implant and in dentistry. For compression, the success rates of normal implants is about 94 to 92. In this technique, the percentage are higher. And why they are higher? They are higher because we're using the best implant there is in the world, and because the technique is more logic to the bone, not for us, but to the bone. So that's why we can achieve those numbers. Now, what happens to the patient? Because most of the patients are thinking, okay, it's a day of torture, but it's not like this. Because in this day, the surgical part of inserting the implants, which is the difficult part, is only 1.5 hours. So if you can think, it's only, if we are taking all the full mouth, it's only about 3 hours that we are dealing inside the mouth, but there are another 4 or 5 hours of lab work, which is outside the mouth. So the patient, after 3 hours, is getting rest, and then after 4 hours we are going back to the patient and inserting the teeth, which is a very simple, easy and a quick thing to do. Behind the scenes of this technique, there's a lot of efforts and a lot of work that is done, but it's not in the patient mouth, so he's not suffering. I think today that that's the most advanced and the most sophisticated way to deal with full arches rehabilitation. And the prices. Now, I know that the price is a big issue, but the prices are not more expensive than normal techniques. And in Malo Clinic Tel Aviv, I can assure you that the prices are very reasonable. Thank you.